So I'd like to introduce Dr. Karina Conde, who is a research associate at the National Scientific and Technical Research Council and a teacher at the National University of Mar del Plata. Her research interests are the characteristics of alcohol use and alcohol-related problems, such as alcohol use disorders, injuries, etc., in Argentina, and the development and evaluation of technology in the field. She recently worked in the assessment of public policies for the reduction of alcohol-related harms in Latin America. Today, she will be presenting on alcohol consumption during the COVID-19 pandemic in Argentina, opportunities for public policies. So over to you, Karina.
Okay, thank you very much. Thank you for the presentation. I'm going to share my screen now. Okay. First, I would like to thank the organizers and Dr. Fitzgerald and Mohan for the opportunity to present the latest result of our study in this important meeting. I would like to start also with a little bit of context and the alcohol use in our country, in Argentina. It is similar to the one presented in Chile. People consume in average 9 liters of pure alcohol per year. So consumption is among the highest of the region. It is believed that 9 out of 10 Argentinians have ever drank alcohol, with little difference among genders. Alcohol-related problems are also very prevalent, and among youth particularly. And the more prevalent problems are blackouts and injuries, and heavy episode drinking is also very prevalent. We estimate that 4 out of 10 young people have this drinking pattern. I would like to also mention some contextual factors. By the time we did the study, in March of 2020, the main strategy promoted by the country was a system of 5 phases of strict lockdown. As the time goes by, they eased some of the restrictions, but larger cities with a lot of population were still in strict lockdown. That means that only essential workers could go to work. This means physicians, plastic supplies providers, nurses, and security forces. There were also economic constraints. Before the pandemic, we were already in an economic crisis, and that deepened when pandemic started. The state gives some relief to people, but when we measure in our study, around half of the population have reduced their incomes. Now I'm moving forward to the study characteristics. We use a non-probabilistic sample. We measure the alcohol consumption in 2 phases. That is 3 months before the first cases appear in Argentina and 3 months after the first cases appear. Data collection started by late June, and we ended it by the end of July 2020. We also use an online platform, Lime Survey. We use the link to the questionnaire in different social media. This is Facebook, Instagram, and Twitter. We use publicity algorithms to ensure the participation of different states of the country. Of the 2,373 people that could participate on the study, we ended up with 1,446 people. That is because we only use people that were current drinkers. We didn't use those who didn't drink in the past 12 months. For measuring alcohol use, we use 3 measures. This is frequency, quantity, and heavy episodic drinking. Quantity was measured in standard units, that is 12 grams of pure alcohol. Frequency and heavy episodic drinking were measured with the alcohol use identification test, and so were the alcohol-related problems. We used the part of the problems of the audit. We also measure socio-demographic characteristics such as sex, gender, age, and change in income. That is, if they had a higher income, equal income, or they had reduced their income. And we also evaluate alcohol-related purchases. This means people who stocked up alcohol before the lockdown started, people who use a delivery system to purchase alcohol, or people who violated the quarantine or the lockdown to buy alcohol. For the total sample, we found reductions on quantity, frequency, heavy episode drinking, and alcohol-related problems. In gender, we find some difference. While females had reduced for the 4 dimensions of alcohol use, alcohol-related problems, men had reduced quantity, heavy episode drinking, and related problems. That means they didn't reduce frequency. And we also evaluated non-binary transgender groups. We didn't find any change in their consumption. For age, the results were similar to those presented in Chile also. The higher reductions were in those 30 and younger, particularly in those 15 to 18 years in all the 4 dimensions. For those who were more than 30 years, we find reductions only in heavy episode drinking and alcohol-related problems. Related to income, we find no reductions in quantity and frequency for those with higher income. They reduce, they have a higher income now in the pandemic. But they have reductions in heavy episode drinking and alcohol-related problems. And those with equal income had not reduced their frequency. However, those with a few reduced income had reduced all of the 4 dimensions: quantity, frequency, heavy episode drinking, and alcohol-related problems. In relation to the groups of alcohol purchases, frequency was higher in those who stocked up before the pandemic, but they have reduced heavy episode drinking and alcohol-related problems. Quantity increased in those who violated the lockdown to purchase alcohol, but again, alcohol-related problems were reduced. And also we found that those who use a delivery system have reduced heavy episode drinking and alcohol-related problems, but quantity and frequency were the same. In those who didn't use any of these strategies to acquire alcohol, for the 4 dimensions were also reduced. I would like to mention some other findings in our country. There were 2 earlier studies, one in the Buenos Aires and one in Córdoba city, mainly. I say these are early studies because they measure only the first month of the lockdown. They found, the study in Buenos Aires found that those with 30 years or more, they had tripled their alcohol consumption, but those who were under 30 reduced their consumption. And those in Córdoba found that alcohol consumption diminished in the weekends and was higher in weekdays. This is interesting because those who drink at weekends are usually young people. And they also found that their main reason to reduce alcohol drinking was that there wasn't availability to buy it. So they perceived the access to alcohol beverage as restricted. So the main takeaway for our study was that it's an observation also, as they mentioned before, of the environment of drinking behaviors and problems. Is like a natural experiment. So here we found that with important reductions in heavy episode drinkings, we have also important reductions in alcohol-related problems. So diminishing of negative consequences in drinking could be attributed in first place to the reduction of quantity and frequency, but also the large reductions in heavy episode drinkings which are strongly related to other problems which are blackouts and injuries. And for example, others like drinking and driving. And furthermore, the social environment factors, there are social environment factors that could increase the vulnerability of these groups and the cumulative risk, which are that they reduce mobility. So they could not go to some place, drink, and then drive to their homes because nobody could get out, basically. The reductions in young people also highlight the importance of the social environment in alcohol consumption. In Argentina, alcohol is sold in supermarkets and retail stores. But despite this, the young people usually drink alcohol in on-site premises, outlets, and even more findings suggest that restricted access to alcohol, either to on and off premises sales, could be an effective measure to reduce consumption and related problems among youth. This is something that we found also in another study that we measure on and off premises, where there was less on-premises stores, the younger people had less injuries as well. Although there are much more evidence from the Northern Hemisphere, this study is important because we can find some evidence of how these measures, these public policy measures, could affect the consumption in young persons, and to limit the consumption and the physical availability of alcohol beverage. So, well, I think yeah, that's it. So, thank you.
Okay. That's great, Karina. Thank you very much for that. And well, welcome. We have a few minutes for questions from the audience. I see Paula's hand is up.
Yes. Thank you, Karina. Very, very interesting what has happened in Argentina, quite similar to what we found in Chile. And I was wondering what was the reaction observed in the industry, alcohol industry, during this phase, this COVID lockdowns and phase. What did alcohol industry do? Did they change strategies? Like in Chile, they had this very aggressive advertisement of web sales and online.
Yes, they use a lot of publicity and promotions, and they also have a lot of delivery systems. For example, we have a lot of places that sell beer, and they quickly implemented delivery systems and promotions for those who had big buys, and all of that. We saw a lot of that. But as you said, now that bars are open again, it's like if they are back to the way they were before.
Okay, so an episodic drinking in Argentina is somehow different of, I think, from episodic drinking in Chile, because ours is very much related to spirits, our local pisco, okay? And what happened in Argentina with that?
No, we have mainly the drinking is only in bars, and when it is in youth, it's mainly beer in youth. But in older people, we have a Mediterranean pattern. So we have for youth beer, and for older people wine every day. See, yes, also spirits as well.
Okay. Okay, thank you very much.